To dive deeper into the pandemic's impact now on schools in North Alabama.
We are joined by Dr. Hassoun, an infectious disease specialist at Huntsville Hospital. Thank you so much for being with us tonight.
Oh, thank you for having me.
Now, Dr. Hassoun, you have said many times right here on WAAY 31, we probably should not be opening schools. And now it seems we're learning about new cases in schools almost every day. Is this just a bump in the road at the beginning of the school year or a warning of more to come?
In my opinion, we're going to continue to see this issue because there is a community widespread infection that we're seeing and having problem with. So definitely we'll continue to see this. We're going to need to think and rethink the process and how we can reduce these infections. It's very difficult while you have kids around in the school to control this. It's really going to be very difficult. We really need to get the school rethink it again, those who decided to do face-to-face learning.
Dr. Hassoun, even with safety measures in place, do you believe that schools will make it through this academic school year with students in the classroom, or do you think they're going to have to shut down?
So, in my opinion, at the moment, with how much we're seeing, it will be very difficult to maintain normal way of education and teaching with these safety measures even. Because these safety measures are very good. To try to do our best, absolutely yes. But the issue with that widespread of infection, trying to get the kids to avoid close contact, try to avoid contamination, it's very, very difficult. And the teachers will be hard on them because they're going to get exposed at the same time. Controlling these clusters of infection will be very tough. I really still think it's a good idea in the next, like what Huntsville City and Madison City School decided, to push it as virtual for the next 5-6 weeks now, waiting for cases to go down. And as we see cases go down, sure, we want our kids to learn. We want to get the best education, but we want their safety and the safety of the teachers, whoever around them as well.
And you know, the benefits of opening schools, the argument is in terms of in-person learning, children's emotional, mental health, meal programs, all these other factors, but you don't think that outweighs the risk of coronavirus?
So I think it's very important and it's definitely essential, but I think at the same time, and I've seen it between parents, between hospital staff, anybody get exposed, they get under significant stress and pressure, not just for themselves, but for their family, whoever surrounding them, what to do about it, and that stress can continue for 1 to 2 weeks till they get tested, till they get follow-up, do they develop symptoms. So there's, on the other side, there's these issues that pop up. And we are all in a state of emergency from the pandemic. We want to control this as much as we can. And obviously what's happening in schools not helping, because you're going to get more exposures and you're going to see more infection and admission to the hospital and complications.
The first high school football game in North Alabama is scheduled for next week. Meanwhile, the entire Athens high school football team is quarantining after 2 players tested positive. Can high school sports actually happen safely this fall?
Yeah, again, I would say that, and I've said it before, if we really want to play sports, if we really want to open up things, we're going to need to have testing easily, readily available. And not just that, it's going to need to be pretty fast in a way where you get results very fast. You're going to need to test these athletes on regular basis, almost daily, to make sure they don't get exposed, they don't get infection, and at the same time they don't expose anybody else. So I don't see this going to happen. So it'll be tough to play sport without seeing cases happening, closures, canceling, some of these venue or competitions. We're going to see some of that if we continue to do the same thing.
The Alabama High School Athletic Association released a memo about spectators and high school athletes. Spectators are required to social distance, avoid physical contact, wear face masks. If there are high school sports this fall, should there be any fans allowed in at all?
Yeah, from my experience and what I've seen done for sports around the world, they do not allow spectators when you have a widespread community infection. The moment that spread go down and numbers go down, there's a possibility. But whenever you have widespread infection, they'll never allow any spectators into the stadiums. And I think that should be done here the same way, because we putting ourselves in the way of danger, because we're trying to control this. The moment we start opening all this, we're going to have more and more cases.
We know the University of North Alabama and the University of Alabama in Huntsville won't play sports in the fall after their conferences postponed them. Was this the right call, Dr. Hassoun?
Absolutely. I really think it's the right call. You know, we always can plan for things to restart again, but we need to see a reduction in cases. So I think they made the right decision at the moment. Till they see, make sure the cases go down, and it's for the safety for everyone, for players, coaches, everybody around them. So by doing this, they made the right choice, I think.
Really quick, Dr. Hassoun, this is a little off topic of schools, but you mentioned testing a moment ago, and we reported in our last newscast that the demand for testing has gone down. In fact, Huntsville Hospital is going to stop using their drive-through clinic. Why is that happening, do you think?
So I can tell you, I mean, we're hoping that's some sign that the cases of infection is going down, but at the same time, I'm worried some of the patients is not willing to be tested much as well. They don't want to know status-wise, because that will prevent them from go to work, that will prevent them from going out and doing things. Definitely reduction in testing might be a good sign, but we still have a positivity rate about 15%. That's still pretty significant. But not just the testing part, Dan, it's, you know, how fast we get these results. We still have issue with reagents and swabs. It's not easy when you get to schools and sports to do testing, and you don't have any of that even in the hospital readily available. It's just how to go with this logistic. We need to think about it well when we plan things.
We have a lot more to discuss with Dr. Hassoun tonight, including the recent decrease in coronavirus hospitalizations.
Stay with us. You're watching WAAY 31 News at 6.
Coverage you can count on. You're watching WAAY 31 News with Dan Shaffer, Najahe Sherman, Chief Meteorologist Kate McKenna, and Lyndon Blake with sports.
We're good. I'm gonna talk anything.
Huh?
Nat mic is down. It's just kind of loud out here with all the bugs and everything. I turned down Hassoun's a little bit, so you might want to turn him up, but it's still just gonna pick up. There's no Nat sounds coming through. I don't know if you heard that.
I don't.
I tapped the what?
He didn't hear you. Shotgun. Mike.
Doing it. Tapping.
What do you mean? I'm tapping it.
You need to record that. Let me just do that.
I can't control the bugs. I'm checking. There's no gain on audio on these things. Yeah, it's completely down. I'm not seeing any levels on channel 2, so I don't know what you're picking up.
Oh.
asking me questions and I'm answering, all right? What do you want from me? I'm trying to solve your problems and you're not listening to me. I should be. I get paid more. It'd be nice.
Ooh, that's a good idea.
More work though, so probably not.
One, two, three, four. Sure.
We are back with Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Dr. Hassoun, hospitals all across North Alabama, including Huntsville, Maine, and Helen Keller Hospital, are seeing a decrease in coronavirus inpatients. Certainly good news. Why do you think that is?
Yeah, I'm hoping definitely that the public is helping us with the physical distancing and masking. So there's possibility we're seeing some of the benefit that we've been advising and recommending for a long time. So I'm hoping some of that is working as the physical distancing and the masking has been applied and followed more closely.
We're not seeing the high number of daily coronavirus cases that we did over the past few weeks. Do you think this is the beginning of us getting the virus under control here?
So that's definitely the hope. When we had the significant spike in July, I think the main issue was it happened 2 weeks after the July 4th, gathering and crowding and everything associated with that. My main worry at the moment, we're seeing some relief, some improvement, but as a lot of people pushing for more opening schools and playing sports, we're probably going to see more increase in cases again. And that's why we really want the help as much as we can to avoid these big gatherings, to avoid the close contact. So hopefully we'll continue to have reduction in cases.
Dr. Hassoun, you mentioned the mandatory mask order. It looks like it's working. Scheduled to expire, though, at the end of the month. Do you think it should be extended? And also, Joe Biden today said this should be national.
Absolutely. I think we're going to need to continue with masking and physical distancing, avoiding the big crowds, avoiding close contact, close spaces. These will work. It's going to help us. And I think nationwide it's going to help. And the proof, you see it in the Northeast, there's significant reduction when they follow these. And you see it in other countries as well. I think we're going to need to continue doing it because the virus is not gone. It's still ongoing. We still have widespread infection. And we're going to need to continue with that probably at least for another 6 months or more.
Dr. Hassoun, of course, we all want to know when the pandemic will be over. That requires a vaccine. There is a lot of talk about the Russian vaccine Sputnik. What do you know about it, and where do we stand on the search for a vaccine here in the U.S.?
So there's really not much data about the Russian vaccine. So unfortunately, there's really no published information. The main thing that we're hearing is really through what their physician talking about, where they've done a phase 1, phase 2, and they had some phase 3, kind of 100 patient, 150 patient that they tried on and showed possible benefit. In general, in a normal situation, we really want much more numbers. In a pandemic, 100 is not enough still. We're going to need a little bit more data to confirm is it beneficial or not. So it's very hard at the moment to judge, is this real? Is it effective? Is it safe? Because we really don't have much information.
As we mentioned, there is a lot of positive news out there recently, but also still a lot of negative. So where do you think we go from here?
Yeah, I think we are seeing some reduction in cases, and that's a good positive news. I think we've seen the Northeast states have seen a reduction in cases. So these are all good news. So we know what to do to reduce numbers. The negative part I can tell you is we really still have people don't believe in masking, don't believe in physical distancing, or don't believe in the virus itself. And unfortunately, we've seen people suffer from that in the hospital. I think we're gonna need again and again with taking the positives and work on it and try to get more and more reduction in cases. And it's been shown we can do it. And I think that's definitely possible in the next few months if we follow the guidelines and the recommendation.
Dr. Hassoun, what is your final message to our community tonight?
Yeah, you know, as a public, I think the community is helping us to cut down on infection. We still don't see significant reduction, but there's some hope in that. And I really hope, and we've always discussed that, I hope our community will keep doing the best for not just their family, but for their friend, for their neighbors, and for the public. And by doing that, we'll be able actually, if we cut down our cases to be less than 10%, the best less than 5%, we'll be able to open up everything almost. But we're gonna need to work it out all together. And you know, other places have done it, other countries have done it, and I think Huntsville, Madison County can do it because they know the basic rules to follow.
All right, we appreciate it. Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
Thank you so much for your time and insight tonight.
Thank you so much.